Hi, everyone. Welcome to Career Cloud by Give Specific. I am Dr. Amber Rains, and today I am here with Dr. Earl Stewart. How are you?
Good. How are you?
Wonderful. Thank you. Thank you. We have Dr. Earl Stewart here today, and I am going to read his bio, and so that we'll be able to learn all of the great things involved in internal medicine. Dr. Earl Stewart is an internal medicine physician with Wellstar Medical Group in Atlanta, Georgia. He is an alumnus of Mercer University, where he attained a Bachelor of Science degree in biology in 2009. Dr. Stewart later attended the historic Meharry Medical College's School of Medicine, graduating with honors in 2013. He completed his residency training in categorical internal medicine at the Warren Alpert Medical School of the prestigious Brown University and its affiliated hospitals in Providence, Rhode Island. Prior to joining Wellstar, he served as a primary care physician in a private practice with Thomaston Medical Clinic, PC. There, he also started a Walk with the Doc chapter for Thomaston and Upson County. He is board certified in internal medicine by the American Board of Internal Medicine. He is founding president and CEO of the Dr. Earl Stewart Jr. Family Foundation and is a published poet of 3 books, which we will link in the description box below. He's a frequently invited lecturer, presenter, mentor to youth groups, and medical essayist. He is very passionate about community service and has a specific goal directed at the elimination of food deserts in economically and disadvantaged communities. His clinical interests are cardiovascular disease prevention, preventative medicine, spirituality in medicine, heart failure management and primary care, opioid addiction treatment, health disparities elimination, diversity in medicine, and end-of-life care. So it's safe to say that Dr. Stewart has not only been committed to advancing the cause of medicine, but also advancing the causes of the community. And before we get into the interview, I will say that we've known each other almost 15 years since we started in undergrad at Mercer University. So thank you so much for your willingness to come and participate today in the Career Cloud interviews.
My pleasure and my privilege to be with you today, Amber. And thank you for reading all of that. You didn't have to, but it's been wonderful to be a part of such a wonderful organization committed to the community. So our goals align in more ways than one. So thank you.
Wonderful, wonderful. Thank you. So we will start with a question. How did you become interested in medicine?
Well, my interest in medicine started very early. Believe it or not, during the early years of my life, I wanted to be an attorney. Much of my interest career-wise came from seeing people, particularly African-American men of stature and of significant importance, if you will, in the community in which I grew up in Augusta, Georgia. And I always wanted to be like that. My father was ex-military. He really wasn't much of an academic, but I credited myself as being somewhat of an academic even early on. And one of the best things that ever happened to me was going to A.R. Johnson Health Science and Engineering Magnet High School in Augusta, because it allowed me the opportunity to get out of the classroom and to get into the local medical community, to basically see physicians who look like me. I'm a stark believer in what we see that we will become. And so my village, if you will, was not only my neighborhood, not only my church, which was a very integral part of my upbringing, but also African-American men who took me under their wing, who just happened to practice medicine and who did it with such a significant desire to impact not only the community in which they practice, but also the lives of other young people, Black and brown, who wanted to do the same thing. So I saw that early on in my father's in medicine. I called him Dr. Mac Andrew Bowman in Augusta, who's a cardiologist, and his partner, Dr. Michael Holman. They've been practicing almost 40 years individually together, and I look up to them. I still do, and they really showed me the ropes of what it meant to not just be or want to be a physician, but to be an African American physician with a social mission. And so that was my first introduction to medicine.
Thank you. Thank you. And I really like how you said with a social mission on that. So, speaking of social missions, are there any quotes that you think of often or live your life by as you're navigating not only your life and medicine together?
My faith is very important to me. It always has been, and I'm sitting here at my home desk, and I'm seeing a picture of my grandmother looking at me. She's now gone on to be with the Lord. She's deceased as of 2014, but she was really my first introduction to the church and to to borrow words from Minister Louis Farrakhan, the exquisite beauty of the Black church. And so she grabbed me early on as a child, took me to church, and basically gave me the exposure to men who were not perfect, but men who were accomplished, who were deacons of the church, and who basically had a commitment to mentorship of African American young men from the inner city, of which I was. And I say that proudly, that I was a product of the inner city. And I so often say that I had a good village, and the church was a part of that village. And to answer your question more specifically, leading up to that quote, "Do unto others as you would have them do unto you." That's
Mhm.
one of the mantras, if you will, by which I live. But another quote always comes to mind that sometimes I think we all have a tendency to overlook: "Be kind to everyone you meet, because everyone is fighting a hard battle." And I remember writing a speech, and I went back and looked up the origin of that. It's actually from a sermon by a Dutch minister around Christmas time, many years ago in the 1800s, who was the first person credited to have said that. And it is so true, because I feel like more so get a chance to experience that every day in medicine, because I see so many people fighting hard battles that I come face to face with the manifestation of that quote every day. So those are two tenets by which I live, two mantras by which I pattern my life, and I think it really has a lot to do with why I chose to go into this profession.
Thank you. So, as we talk about how you navigate utilizing these tenets, what kind of problems do you deal with as a physician?
Internal medicine, I often joke and say it's the perfect specialty for individuals in medicine with commitment issues. There's so much that you can do. You can there's a period of time, if you get tired of doing academics and teaching, you can go into private practice. If you get tired of private practice, you can go and do consulting with a pharmaceutical company, or if you get tired of that, you can become a medical director at a hospice facility or a nursing home. So what I deal with in primary care now every day is basically the care of acute illnesses and chronic diseases. But at the center of both of those is prevention. And I really, really, truly, honestly believe the quote that an ounce of prevention is better than a pound of cure. I love primary care because we are doing annual physicals where we're strictly during a visit for about 40 minutes to an hour, depending on what type of environment in which you work. You are focused on hitting the major points to prevent a person from having diseases, from developing diseases, from the perspective of making sure that their immunizations are up to date, making sure that you do age-appropriate cancer screenings, making sure that you do preventive care that's basically going to keep that person out of the hospital and help them have a pretty good quality of life. So from day to day, that's what I really enjoy doing the most. I know you didn't ask that question, but I felt like, it was germane to that specific point. But we, in primary care, across the spectrum of that particular type of medical practice, deal with acute illnesses, preventive care, and the management of chronic diseases. And many people will know about high blood pressure and
Mhm.
diabetes. So we focus on those are two probably the most common ones that I see, and also obesity. I see a lot of patients who are overweight or obese, which of course we know can lead to some of those lifestyle related diseases, including diabetes and hypertension. So that's a typical day.
Thank you. And I was going to ask you what you enjoy most about the work that you do. So do you consider what you just said as part of that, or would you go beyond just talking about that area within medicine?
Well, I will always stretch a little bit further and say that there is nothing more gratifying than taking something that you have read, something that you have trained to be able to recognize, whether it be certain patterns of symptoms or certain signs of certain medical conditions that you can apply to a specific patient's plight, and basically, as a scientist, test the hypothesis with imaging and medical treatment, whether it be pills or getting them to a specific subspecialist, or drawing blood, and then figuring out what exactly is going on with that patient, apply, the appropriate treatments and management, and get that patient feeling better. There is nothing more gratifying to me than that. But I also love the fact that I am able to reach back and pull others forward who might be interested in the profession. So I definitely have committed a significant amount of my time and a significant component of my career now and moving forward, and even in the past for a little bit of time, to teaching and to not only teach my patients, but to teach nurse practitioner students, medical students, whoever may be interested, pre-medical students who may be interested in rotating and learning the ropes of the profession, because that was done for me. It would be robbery for me to not give back, because so much was given to me that inspired me to enter this noble profession.
So as we talk about being able to improve health outcomes for a patient, I guess the transformative process of healing, in addition to reaching back to helping others, which would lead me to another question. What do you wish you had known when you were starting out in medicine? And think of it in terms of reaching back and telling, the pre-med student.
I wish I had known that the system is broken. And I say that not mincing any words, because that really sums up everything that we see right now in the medical profession. The system is broken, but it's a beautifully intricate system that has the ability to be better, but it's pretty good right now, but it's not as best as it could be. What I mean by that is, if I know that a medication is best for my patient who I have known for years, it's well researched, it's an excellent medication for that specific patient's medical problem, I prescribe it. And then there are others who tell me that because the patient can't afford it, the patient probably can't get it. And so the premise of that statement is, I wish someone had told me that I would have to be my patient's greatest advocate Now, there are ways to maneuver the system. You have to be, in order to be a good doctor and to get the patient the treatment that the patient needs, you have to be an advocate. You can't just, punt that specific exercise to someone else. You have to be able to maneuver the system. I Some of the residents that I used to teach when I was a resident used to say that used to quote something I always would say. I would always say you have to make the hospital in totality bend to the needs of your specific patient, of your patient. That's your job as a physician, and really it is. I feel like that's never more true than in primary care. There's so much that goes on behind the scenes that people don't see, that, at the end of the day, we don't just rush out and go home. We're sitting there trying to do prior authorizations, which nobody ever taught me about in medical school. We never had to do prior authorization at Meharry. We never had to do a prior authorization at Brown. I never had to do that. And now I believe, as a response of the insurance companies to the Affordable Care Act, aka Obamacare, we're taxed to do something additional to get our patients what they need. And nobody really taught us that. I think it depends on you as an individual person. It depends on where you went to medical school, whether or not they truly incorporate the beauty of the social mission into your education. But I think a lot of it depends on the individual person's ability to be able to be willing to do that and not punt that to someone else. I think that distinguishes us, among ourselves, from the physicians who care, from those who just, laissez-faire, let it happen. Whatever happens, happen. If the patient gets the medicine, if the patient gets the treatment, they get it. If they don't, they don't. I think that's a very inappropriate stance to take as someone committed to providing holistic care. So nobody ever told us that. Nobody ever told me that the system was broken, and that as a physician, though I'm taxed to be the leader of a healthcare team, that I can still be overruled in this broken system by an insurance company that doesn't agree with what I think is best for my patient. And hopefully things will get better, but that's, as we say, on the real. I mean, that's just how it is right now.
Thank you for your wisdom and sharing that. And as we talk about leadership and basically your answer that you just gave us was that being a leader is imperative beyond the scope of knowing medicine. You have to be able to lead in order and advocate for your patient to receive the best care. And I was over here thinking about leaders recognize where they failed and how they overcome failures. And I wanted to ask, how has a failure or apparent failures later set you up for success?
Failures are encountered every day in medicine. That's why we call it, a more cliche statement, the practice of medicine, just because we have recognized that we don't know all. The structure of how we practice is, if we need a second opinion on something about a particular patient's condition or disease, we're able to do that by way of referral to someone who has a little bit more training, a little bit more expertise than I may on something else. And we're often consulted as an internal medicine general specialist. Sometimes people will consult us to do preoperative clearance for surgeries for patients, or psychiatrists will access to do medical evaluations of patients for different things. So there are always opportunities to be collegial, where you don't necessarily you don't necessarily have to take among yourself the burden of trying to know everything about all things all the time. And I think that's the beauty of this sort of profession, where we can easily look something up. We can easily go back to the drawing board and say, we're probably not going down the right route in terms of finding out what's going on with this patient. Whether and that happens more often in diseases that we've never seen before, and we discover that every day. We discover that no one patient always meets the textbook of a specific condition. We're always going back and say, is this an atypical presentation of something that we already know about? And so I have encountered failure before. I haven't get, doctors, sometimes we'll lose patients, especially if we don't know what's going on, especially if we're not able to diagnose something in time. Um, I've had specific instances before where I've had to go back to the drawing board and say, I probably, even as a resident and also as someone, the term that we use once you finish all of your training is attending. So as an attending physician now, I still have to go back and reread and remain up to date and always know that there's something that I may not know about. There's something new that may be out there that I haven't heard about. And I have to be willing, as someone who is prone to failure, to learn about it, to learn new stuff. I think we do a tremendous detriment to ourselves as scientists and as medical experts, if you will, to not want to learn about what's new and better and more cost effective for each individual patient. Failure has taught me that I'm human, which I think sometimes it's easy to forget in this profession because it's expected of you sometimes to just operate in a system that can make you almost appear to be robotic, where you are just a lean, mean, patient-seeing machine. When in fact, that will not allow you to connect with and communicate with your patients as best as you can. I look at each individual patient as a human, and I think having that mentality allows them to see me as a human and not just a machine, not just a robot, not just someone who is seeing them but has no emotion. You have to have emotion. You have to have that in order to be able to connect with each individual patient. But you also have to remember that through it all, you're trying to help another human. If you ever forget that, then it's time to leave. It's not the right profession to be in. And failure teaches me that every day. That hey, I don't know everything. I will never know everything, and I'm prone to learn new stuff. I should make myself available to learn new and better things.
Thank you for laying out that framework. And as we near the close of the interview, time is moving very fast, unfortunately. I guess one final question would be, what advice do you have for a driven college student interested in pursuing internal medicine specifically?
I would encourage that student to be a sponge. Internal medicine is a specific specialty where we focus on everything. Some people say sometimes we're the greatest deliberative specialty in medicine, but they use other words sometimes for that, which is not from mixed company. But I will say you have to be willing to learn from every experience. You have to be willing to learn from the custodians in the hospital just as well as you are willing to learn from the chief medical officer or the CEO. You have to be willing to learn from each individual patient. You have to be able to learn what your mentors do right as equally as you are willing to learn what they did wrong. And if you are a sponge, that will position you in such a way where you're able to learn from each individual experience. It really is a gross exercise in lifelong learning. And if that student has the ability to do that, then it will make him or her really a fine physician, someone who the patients will seek out, and someone who the patients will be instantly able to trust because they are not, someone committed to the Cliff Notes version of everything. They want to read, they want to learn, they want to engage in each individual experience. You learn from so much in medicine. Retrospectively, I've learned that, you know, I say to myself sometimes, hey man, you know what, if I was at Mercer, why didn't I go back and audit a political science course just because I could have and learned from that experience? At Meharry, what other courses could I have taken? But, you know, some of that is not in our control. We have certain curricula to follow, but I think definitely if the greatest advice I've ever gotten was to soak up everything that you see. And I think that if you want to become a physician, if you want to become an internal medicine specialist, that will be the greatest thing that I can ever tell you, because that's something that was always encouraged in me to do.
Well, thank you. Thank you so much again for your willingness to take the time out to do this interview. And I did want to ask, is there any type of location where students can follow your progress as a physician, or any books or any advice that you may be providing on any social networks or websites?
Sure, I have a personal blog where I talk about I love to cook, so and I garden, so I love to cook from my garden. So they can follow me there. There's information. So it's my personal blog, esjmd.wordpress.com. I'm also on Twitter at Earl Stewart Jr. I always tweet about exciting new medical topics that's pique my interest, but also about various dishes that I cook. That's a favorite pastime of mine. Also, I'm going to put in a plug about my family foundation, esjmdfamily.org.org. That's we're very proud of that organization. It's a private family organization, but it's enabling us since the inception of it to do some great work throughout the state of Georgia, but and in the Southeast, and also more specifically in my hometown, where we're reaching back to pull other students forward who look like us and who are interested in achieving great things, and many of them are. So those would be some of the ways that the students can connect with me, and I'd love to connect with them.
Wonderful. So we will put your foundation link, as well as your personal blog and your Twitter link, in the description box below, so that students will be able to find that. And as we conclude, I would like to thank everyone for watching, encourage you to subscribe to the Give Specific channel for more interviews of this type with other professionals that are changing lives within communities. Also, feel free to support our Patreon at patreon.com/givespecific. We'd love to have you as a member, or you can donate through our website at givespecific.org. Thank you again, Dr. Stewart, for being a friend of Give Specific. And we wish you all the best in all of the great things that you're doing.
Amber, thank you so much. God bless you.
Thank you.
Bye-bye.